So we're back with our Ask Me Anything series with Ann Johnson, our expert trained in clinical psychology and professor at ONU. And this next question has to do with how do we help kids cope with and deal with all of the questions that come around the COVID-19? Why is it that I have to wear a mask and my friend at school doesn't have to? Or why is it that everybody seems to be fighting about this? Or what is it that they're saying on the news? Kids absorb this kind of stuff. They hear it. So how do we help them cope with it? How do we help them deal with it?
Yeah. So the first question about, so what do they do if they go to school and some of their friends are wearing masks and some are not? That's kind of maybe a starting point as a question. For that one, it depends on the age of the kid. So for younger kids, they're going to be influenced by peers, but they're still going to be really responsive to parents and parents' feedback. So if the parents are at home are modeling the behavior of wearing masks, they're explaining that it's important to the family, they're wearing them as a family when they go out, on a regular basis, it's pretty likely the kids will comply with the parents because they see parents as an important sort of figure, and they see things as pretty black and white role-wise. So if the parent puts that in place and the kid understands it's important, they'll probably do a pretty good job of kind of getting it. As long as the parent is reinforcing it on a regular basis and helping the child understand if they do have anxieties, how to deal with that. Or if this friend's not wearing one, helping to have a good discussion about why you still need to wear one even though your friend's not. Middle school and high school can get a bit trickier, probably, as all parents of middle schoolers and high schoolers would understand. They have their own independent thoughts, their own independent sort of rule systems that they're creating. They may have a little bit different take on that question. So a parent may want them to wear one and the child may be more resistant to that. But I think it still sort of comes back to the same thing. It'll be about having a discussion amongst the family as to why it's important. If a child doesn't want to wear one, then it's a discussion about what does that mean for us as a family then? So what risks are there, or why is it so important to us that happened? And there can be potentially consequences the parent could utilize as a way to ensure that behavior happens, if it's really important to them. But that has to be a family-wide discussion about that for the older kids especially. As far as the managing anxieties about their hearing and seeing exposed to, again, it depends a lot on the age of the kid. For younger kids, it's just answering their questions as they have them in a way that doesn't take things out of context. So for my own children, I have 7, 4, and a 2-year-old. We do have discussions about it pretty often. They see the virus as just a thing that's happening. We have to wear them because of the virus. And one of my kids will ask about doing something that we probably aren't able to really do safely right now. I don't take them into lots of stores, for example, with people around. Then another kid will say, oh, it's virus time. It's just not a thing we're going to do at this moment. They get that there's sort of a larger context happening and we do other stuff, but not that stuff. And so it can kind of help them manage it at their level. My older child has more questions about what it means, and we try to give her the information that's appropriate age-wise to her. Do we break down every stat about sort of morbidity rates and mortality rates and sort of everything going on? No. But we do try to give her the information that we think will help to answer her questions that she has in a way that she can sort of better grasp why we're asking her for what we're asking for. But it has to be a family-wide discussion about that, and doing your best as a parent, as a family, to address the concerns that everyone has. They're on the same page.
Okay. Well, thank you very much. I appreciate you taking the time to answer some of our Ask Me Anything questions. We appreciate it.
No problem.